Consider the story of a patient I'll call Margaret. At 68, she was incredibly sharp, finished crosswords daily, and recalled every family birthday without needing any notes. Her daughter viewed her as the family's living encyclopedia. However, roughly 18 months after starting a new daily prescription, her daughter contacted me distraught. Margaret forgot her morning meals. She became disoriented driving home from a grocery store she had frequented for 2 decades. She asked identical questions multiple times during short talks. Her specialists suspected early onset dementia. Her relatives were heartbroken, yet there is a detail nobody shared with them, which you must understand immediately. Margaret's cognitive decline was not actually Alzheimer's disease. The culprit was her medicine cabinet. By systematically reviewing her pills and making careful adjustments under medical supervision, Margaret began returning to herself. Within 4 months, her crossword puzzles resumed. This isn't a supernatural tale, it is preventative health care. Today, I will explain the 9 frequent medications that might be quietly and invisibly eroding your memory, ordered from common oversights to the most hazardous combinations that many physicians fail to mention. I am Dr. Lana Mitchell, and these 20 minutes could be your most vital investment this year. Before we begin, stay tuned until number 1 because it isn't just one pill. It is a concealed trend impacting millions of seniors that almost no one discusses. Let's start. Now, I must clarify something before reviewing this list. I am not suggesting you quit your meds. Do not do that without consulting your doctor. I am saying you have the right to ask, to understand what enters your body, and to protect your neurological health. Knowledge isn't risky, silence is. Also, please leave a comment below. Are you over 60? Which medications do you take? I read these personally because I want to grasp your struggles. Your story might assist someone else watching. Okay, number 9. Item number 9 is Diphenhydramine. Ask yourself, do you keep a small bottle of Benadryl by your bed? Many do, and I understand why. It's affordable, accessible, and the label says sleep aid. It seems safe, right? Here is what that pink tablet does to a brain over 60. Diphenhydramine is an anticholinergic. This term is crucial, so remember it. These drugs block acetylcholine, the brain's main chemical for memory, focus, and alertness. Young brains have plenty of acetylcholine. After 60, your levels are already lower. Blocking more with nightly use has a major impact. A major study in the Journal of the American Geriatric Society showed older adults using diphenhydramine faced higher cognitive risks and actual brain shrinkage in memory zones during imaging tests. The tricky part, it hides in many non-allergy products. Anything marked PM, nighttime, or sleep formula likely contains it. The alternative? For allergies, ask about second-generation options like loratadine or cetirizine. These don't enter the brain the same way. For sleep, we'll discuss better options later. Number 8, proton pump inhibitors or PPIs. Raise your hand if you take a daily acid reflux pill and have for years without anyone suggesting you stop. This is globally overprescribed. The issue isn't just usage, it's indefinite use when most are meant for 8 to 12 weeks. PPIs lower stomach acid, which sounds fine, but that acid is vital for absorbing vitamin B12. B12 is essential for your brain. Low B12 is linked to memory loss, depression, and cognitive decline that looks so much like Alzheimer's that even experts get confused. A 2016 JAMA Neurology study of 73,000 seniors found long-term PPI users had a 44% higher dementia risk. Furthermore, research suggests PPIs might speed up amyloid beta plaques, the toxic proteins found in Alzheimer's. This isn't just about vitamins. It's a potential path to brain decay. What to do? Discuss tapering off PPIs with your doctor using H2 blockers like famotidine as a bridge. Diet changes, smaller portions, avoiding late meals, and elevating your bed can naturally reduce reflux. If you must stay on them, monitor your B12 and magnesium. If this is helpful, type 8 in the comments so I know you're engaged. Number 7, bladder control drugs. This frustrates me because patients aren't told the risks. Overactive bladder is difficult and affects life quality. When prescribed oxybutynin, you take it. But here is the secret. Oxybutynin is a potent anticholinergic. It doesn't just affect the bladder, it crosses into the brain and disrupts memory systems. Studies show the hippocampus actually shrinks in long-term users. This is a physical change, not just brain fog. A 2019 British Medical Journal study found seniors using these for over a year had a 49% higher dementia risk. That's nearly 1 in 2. Sadly, early symptoms like forgetting names or losing words are blamed on aging. The pill is never blamed. The good news, newer drugs like mirabegron work differently and have much lower cognitive risk. If you've noticed changes, talk to your specialist. Number 6, benzodiazepines. I'll pause because people have strong opinions here. These have helped millions with anxiety and sleep. I'm not ignoring that. But listen to the science. Benzos boost GABA, your calm signal. They work for short-term relief, but long-term use is different. A 2022 six-year study found seniors using benzos for over 3 months had a 51% higher Alzheimer's risk. Long-acting versions like diazepam are the riskiest because they build up in brain tissue. Biologically, when GABA is constantly boosted, the brain reduces its own activity. Neuroplasticity, the ability to learn and adapt, fades. Memory slows. The brain loses its dynamic edge. The trap. Quitting causes brutal withdrawal, making the drug feel necessary even as it causes harm. Note, never quit benzos suddenly. It's dangerous. Work with a doctor on a very slow taper. Try buspirone therapy or magnesium instead. Number 5, statins. I'll be careful because statins save lives by fighting heart disease, the top killer of seniors. But your cardiologist might not mention that your brain is 60% fat. Cholesterol is a structural requirement for your brain, not a villain. It builds the myelin sheath that lets signals travel fast. Without it, neurons struggle. Lowering cholesterol too aggressively can starve the brain. The FDA even added memory loss warnings to statin labels in 2012. A 2023 analysis found seniors over 70 on high-dose statins for 3 years had more cognitive impairment. Crucially, not all statins are equal. Lipophilic ones like simvastatin cross into the brain easily. Hydrophilic ones like pravastatin show much less impact. If you feel foggy, ask about switching types and check your CoQ10 levels, which statins deplete. Share this with loved ones. Many don't know this. Number 4, amitriptyline. This surprises people because it's used for nerve pain, migraines, and fibromyalgia, not just psychiatry. Doctors use its sedative side effect to help patients sleep. However, it is one of the most potent anticholinergics used today. Its effect on memory receptors is higher than many bladder or allergy drugs. A 2015 JAMA study of 3,400 seniors found high exposure linked to a 54% higher dementia risk. Even low doses over time create a heavy burden. The damage is invisible, just a slow erosion of complex thought often blamed on age. Alternatives like duloxetine for pain or modern SSRIs for mood are much safer for older brains. Number 3, antipsychotics. Pay close attention. This happens daily in care facilities, and families often don't know. These powerful drugs were made for schizophrenia, but are now used off-label to sedate restless or difficult seniors. Not for their health, but for staff convenience. The FDA issued warnings years ago about increased death risks, yet the practice continues. These drugs suppress dopamine, which is vital for movement and thinking. A 2022 Lancet study found seniors on these for behavior were 71% more likely to see cognitive decline within a year. If a loved one is on quetiapine or risperidone without psychosis, ask why and ask for a plan to stop. Number 2, paroxetine. This SSRI, Paxil, is in the same family as Prozac, but it is the exception. Unlike its siblings, paroxetine has high anticholinergic activity. A 2021 review found seniors on it showed memory declines not seen with other SSRIs. It's on the official inappropriate list for seniors, yet still frequently prescribed to them. Switching to sertraline or escitalopram often provides the same benefits without the memory risk. Number 1, anticholinergic polypharmacy. This isn't one pill, it's the combination. One drug might cause slight fog, but the average senior takes 4 or more. When several have anticholinergic effects, the risk multiplies. A 2022 analysis of 280,000 adults found those with high combined burden had a 120% higher dementia risk. That's double the risk from pills they were never warned about. Imagine Dorothy, who takes a sleep aid, a bladder pill, and something for nerve pain. 3 are anticholinergic. Each doctor thinks their one pill is fine, but together the score is dangerous. This polypharmacy is a massive hidden driver of dementia. The good news, This decline is often reversible. I've seen mental clarity return when the burden is reduced safely. Your brain can heal. Here's your plan. 1. List everything you take. 2. Check the ACB scale online. 3. Schedule a medication review with your doctor. 4. Ask about deprescribing. 5. Get a second opinion if needed. Share your experience in the comments. You aren't alone, and this isn't inevitable. Share this video to help others. I'm Dr. Lana Mitchell. Protect your brain. You now have the tools.